I think we're good. Preparing. Okay, got it. Hey, Laura, how you doing? Okay, it's so nice today, and my thing flashes a little bit, so hopefully it won't today, and we'll get through this without that happening. But how are you doing today? It's beautiful in the Chicagoland area, and it is sunny and bright. What's going on?
Oh, I am doing absolutely fabulous. And, most of you guys know that I had my knee replacement surgery. It was 2 weeks ago today. I'm walking fantastic. Actually walked in the grocery store yesterday without a riding cart, and I walked the whole jewel. And I've been back at mass in the morning, and even the priest today even made an acknowledgement that he couldn't believe how great I was walking. So yeah, I'm doing fantastic. And I'm
And
so oh go ahead. I'm sorry,
I
Debbie.
was just gonna say, I meant to say welcome back when I was saying it. I'm so excited, and I'm not saying that everything was because of some of the tech you were wearing, but I know that definitely helped you, and it just makes me so happy to see this, because a
Yeah.
lot of people don't get that kind of result, especially with what you've got going on,
Oh
you
yeah,
know?
it's crazy. And yeah, the tech stuff that I got from Vox from through Debbie has been fantastic. And we could talk about more about that later, but it's a great thing if you're really curious about knowing a little bit about what she's got. Send her a message and she'll get back to you. But we're going to talk about something that is so amazing that we should have been talking about before, because so many people, including myself, suffer from this. And Debbie has family too. And that is reflux, GERD. Some people call it GERD or whatever.
Yes. Mhm.
I was diagnosed years ago with it because of the fact that I used to get so much pain in my chest and all kinds of stuff that was happening to me. Plus, I don't have a gallbladder either. So yeah, that even makes, because the gallbladder kind of filters everything. So if you have GERD or the reflux or whatever, you're also, if you have no gallbladder, you're going to suffer even more. So, the first thing that we have to do when we find out we have this, we got to figure out what triggers it. And there's so many things that could trigger it. It could be, it depends on your food you're eating. What you're drinking is a very big thing. How fast you're eating. There's just so many different things. Debbie, you want to add to that at all?
Yeah, you know what? I don't think I could say that I actually suffer from what you're talking about, but I do have family that does. And some of the things that you're just saying, the foods you're eating, how fast you're eating, that plays in because I witness it. Okay. So from a person who doesn't know much about it, sometimes you don't even know what that other person's feeling. And that's why it's good. Lori can actually really, tell us too. But I experience and watch from the outside. And I think one of the hardest parts is that we're going to talk more and more as we go along today, and we're going to kind of bring up in front is that you've really got to be your own advocate. But some of these things cross over. Lori was saying that she had that feeling. Okay, so when you get a feeling that you haven't had before, to define what it is really difficult. And so, Laura, I think the biggest way of getting this figured out is I think it's a gastro doctor. Don't you agree? I think.
Gastro doctor is definitely a person. And there's ways that they could they go on a diet. You go on a diet that takes away a lot of these things that they think it might be, and then they gradually, slowly introduce the food back to you. And if you have a reaction from the food, then it's that particular food, because
Mhm.
there could be so many things. Well, first of all, what happens is your body gets this acid reflux, okay, this reaction to whatever. And it might be from spicy food, caffeine, fried food, fatty foods, but whatever. The one culprit causes the problem. Your esophagus gets affected. It hurts, think of it as a tube, your esophagus is a tube, and something irritates it, so a gas is going to go off, okay, or some kind of irritant. So any other food you're putting in your mouth is irritating it even more.
Mhm.
So that's where this elimination of foods comes. I've never done it. I've always wanted to do it. think I'm gonna think about doing it. And so that's the reason, is the elimination. So they could see what is triggering. Like I said, you get it triggered once and then everything else makes it worse. Does that make sense, Deb?
Totally makes sense. And you and I were talking before this when we got on, and it also was kind of like when you skin your knee and you
Yeah.
got this like abrasion on your knee, right? And so like all of a sudden it's sensitive. Well, it's, you know, when you think about the inside of your throat and going down, like when that's all sensitive, anything that's coming in contact with it, you know, you got to be careful. That's why they have you stay away from certain things and take, you know, certain things to help. You know, maybe they're antacids, maybe they're gas pills, maybe maybe it's something that your doctor has prescribed for you or has, you know, told you, you know, typically to get it to calm down, because otherwise you're going to be having, you know, really sore throat, and also you're just not going to feel good. You know what I mean?
Right.
So,
You're
yeah.
not, you know, and another thing is too, is notice your behaviors, okay? For example, how are you eating your food? Are you a fast eater? I am. You know, my whole family, your mom, dad, everybody was fast eaters. And I think it was because we had a flower shop and we ate as I was working. So that's another thing, eating while you're working, eating when you're watching TV. You know, just the thing is, when you're eating, you have to slow down. And they were saying, this is really cool. They were saying that you shouldn't drink more than 5 ounces of liquid during your meal,
Mm.
okay? Because what happens, your body gets too full too fast, and some of these acts, if you have this problem, your acids are going to get aggravated. So that's
Oh,
less than 5 ounces. Uh,
okay.
Sit down and eat your meal. And it says here, chew their food until it's liquid. So, you know, chewing a lot. And Debbie, you could talk about that because you're an
Mhm.
example of that.
Well, I can say this. I can say that I see that chewing your food is not only important for this, it's important for other things too. Like my husband has diverticulosis, and if he doesn't chew his food good, you know, he can sometimes add to the problem. But you're supposed to take your food and eat and then put your fork down, and you're supposed to, like, you know, savor it or whatever, enjoy it. But when you're eating too fast, then you're literally filling up your body doesn't, your head and your mind and your body doesn't realize that you're full. And so you're eating too fast. So you're actually eating double what you should. So we were doing this analogy. Lori was saying, like, your fist is kind of like, you know, what you're supposed to be like. I guess if you say in your palm is about what you're supposed to do with like some chicken or beef or whatever, like that's your size, right? But then kind of around that, you should have your, whatever, your vegetables, your rice or whatever you're eating, or, and all that. So I think sometimes you can see a correlation in people who have eat too fast, like Laura was saying, and, you know, not chewing your food good and all that stuff, that, you know, you're kind of setting yourself for not kind of going down that road if you're not cautious. You know, you may not have that issue, but if you trigger something, then you've got to, those are some of the habits that you got to think about. Ooh, do I do this? I need to look into changing that. Because, you know, I'll be honest with you, sometimes, Lori, I think that nowadays, and I don't want to bash the medical system, I really don't, okay? But a lot of times these doctors don't have a lot of time to sit there and talk to the patient. So the patient doesn't necessarily get all these tips. And if they don't ask for, like, you know, do you have some information I could have? Or, and if the people don't read it or whatever, and they're not listening and not finding this out, they might be sorry that they didn't implement these simple little things that can help, you know?
Yeah,
So,
I totally agree with that. And you know, another thing too is, you know, eat better foods and you'll digest better. Find out if you don't want to do the food elimination, look and see what foods are good for your body. Okay.
mhm.
Lots of vegetables, a lot of colorful vegetables are really good for you, but it is really important what you eat. I'm going to give you an example. Okay. I've been having so many problems since the surgery with my digestive system. And so I was telling Gary, my boyfriend, I says, like I was telling Debbie, I can only eat like a fistful of food at a time. And then wait 20 minutes if I'm hungry, have more. Because what happens to me is I eat so fast, I don't wait that 20 minutes and I keep eating because I think I'm hungry. And then I get sick and have the acid. So, there's a lot of things that we have to learn to do. And waiting 20 minutes after you've had, one plate of food, you want to have some other seconds, wait the 20 minutes. And again, that is going to help you with your digestive system too. Because your digestive system works the same way your personality does. If you're real fast, it's going to work real fast. If you're aggravated, it's going to get aggravated.
I'm wondering, do we know, like, have you read this yet? Maybe it's in this documentation, and I was looking how big is your stomach? It's pear-shaped, okay? And it is not really that big, you guys. I mean, I was trying to see if I could see, I don't have a good visual, but on this, what I was looking up, but I know our stomach isn't that big.
It's
So do you ever get
this? It's about size.
Yeah. So like if you're just pounding down a bunch of stuff and sticking it in there, I'm not saying you, but I'm saying anyone, okay, anyone who's doing that, and we're overeating, which we've all been guilty of. There's no doubt about it. And you just feel uncomfortable. That's not worth it. The ramifications and everything else, So
I have learned it's not worth it. I do not like the pain. I don't like to be uncomfortable. I don't like the acid building in there. It's just, as you get older, I think it gets worse, because I think our bodies just give up a little bit. They don't process the way they used
right.
to, So yeah, and so that eating a little bit, slow down, that's going to be my new goal. And to wait 20 minutes, see if I want seconds, and see if I really do or not. Remember the old saying, our eyes are bigger than our stomachs. I'm sure everybody's got that one way or another.
Can I interject something so I don't forget this, because I think it's a perfect time. The really healthy way they say to eat is to eat small little meals, like smaller throughout. And so instead of like the 3-meal thing and everybody thinks dinner should be your bigger or whatever, actually they say you should put your bigger one in the middle of the day. But if you can eat smaller things along the way, and so this way, when it comes to that meal time, you are not ravishing, especially if you're an active person, but your metabolism will work better. And your body will function better.
Right.
So, it's a win-win.
Yeah. Oh, yeah. It's a definite win-win. And, like I said, I did all this stuff all my life, because of my work, the way I was growing up, and you know what? Want to hear a funny story, Debbie?
Yep.
I don't even know it from your husband's family being Italian. Italians have a lot of heartburn problems. So it's not necessarily their food, it's about the way they eat and everything. So they have a thing that every household used to have, and I finally found a thing that's called brioche.
I knew it. Yes. Yeah.
At the Italian store. Brioche. And it's it's for all that what they used to call agita. That's what they call heartburn. Agita. You have brioche. So brioche is kind of like an Alka-Seltzer type of a thing.
Yeah. Yeah.
Every household should have brioche in their house. And at most little Italian stores, they hear it. And in fact, I got to get a new one because we're out of it. But yeah, I had to bring that up because brioche. I mean, anybody that's Italian is going to laugh. And you know what? There's some stuff that you could actually consume that will help you with your digestive system. And that is ginger. Parsley may calm down your digestive system. There's some teas out there. That's what my doctor keeps telling me. I got to get probiotics.
Probiotics, yes.
Yeah, I'm like, my mouth is not working right today. How would you describe probiotics? Are you a probiotics taker?
I'm a total probiotics taker. And it's kind of funny. We were talking about probiotics this morning, actually. So many times we have like the bad bacteria and stuff get taken out of our system and everything, especially if you're ever on an antibiotic or whatever. And they always say, oh, make sure you're taking some probiotics because it's the good bacteria that you want to have in there, and you want to have it, and it aids in digestion and it does a lot of stuff. So yes, we do. But I will say, one thing that when it comes to like absorption with probiotics, you want to make sure you're taking it with some food because you want it to absorb. Because sometimes, you know, you don't want to take something and have it go right down the drain, you know, and you're not
Right,
like it's going right through your system. But I want to add to that too. Does your Italian family do a tea that they boil? I want to say it was either, oh gosh, it wasn't basil. Was it mint and lemon and something else that they boil? I know that my daughter and my son-in-law, he told us about something and they would do it and then they would drink it and that would help. You know, you mentioned ginger, peppermint is really good too. And there's a lot of teas you can buy that are like decaf. And at night, that's one thing I would like to do is do a cup of tea before I go to bed, like of decaf peppermint to kind of soothe, you know, your tummy. But they say cinnamon's also good. I don't know if you've heard of cinnamon being good. And then also, I was reading in here, you would think, okay, seriously, if common sense would think, because you think apple cider vinegar sounds like it would be harsher, but they say take a teaspoon of it before you have your meals. Now, I don't get how that works. I really don't, but whatever it's supposed to work. So you can even throw it on your salad, like with your salad dressing. There's a lot of stuff that are so common that we just don't realize we have right in our kitchen. They're staples and we don't have them. We don't use them like we should.
baking soda is another one.
Mm-hmm. Yep.
Mix that with water and stuff. And yeah, there are so many things. What I would suggest you do is go online and look up all the different things. And if you go to YouTube, I didn't have a chance to do that the last couple of days, and look up remedies for reflux and GERD, and you're going to see
Mm-hmm.
all kinds of stuff that they suggest. Another thing is, I know we don't like about this is to say moving your bowels and getting your
Mm-hmm.
body to clean its system out.
Mm-hmm.
You have an issue with it.
Huge. It's
And
huge.
it's
Mm-hmm.
there are supplements that you could take to help with that, and that's
Mm-hmm.
carnosine, glutamine, magnesium is huge, and they will make your bowels regular. Because that's another thing. If you're not going to the bathroom and you're building up all this acid in your body, because you have what? How many feet is that? 36 feet of
I don't know. It's huge. It's huge.
intestines. And if your bowels are not moving correctly, you're going to be building up all kinds of acids
Right.
in your body. So, you know, that's a big thing too. Again, there are so many options out there, you know.
Mm-hmm.
Do you have anything to add on to that, Deb?
I have two things to piggyback on baking soda. So a pinch of baking soda like this in a cup of coffee will get like, because some coffees can be more acidic, especially if you drink a little stronger blend. That's really good. And then have you ever done a potato when you're making your big pot of marinara or sauce or whatever you want to call it, have you ever put a potato in there?
No, I've
That's
never heard
supposed,
of that.
that's supposed to draw all the acid to the potato.
Really? Oh, that's
Because tomatoes have acid, so it's, you know what I mean? But they're so good, and they're so good for you. The lycopens or whatever is in the tomato. I mean, that's the health benefit. There's so many health benefits. So like we're getting health benefits, but then we're getting the things that kind of can aggravate us. So then the goal is to figure out the balance of what works for you. That's the key there, the balance,
and I'm gonna try that with the potato. I usually put a little sugar in there, but I'm gonna you put the potato in whole.
What I do is I'll peel the potato and maybe cut it in half and maybe put a couple chunks in or just one little piece of it or whatever. And I just put it in there and cook it with the sauce. You know what? I was told this a long time ago. So I just did what I was told. I was like, okay, this is what works. I'm like, all right.
That's why the Italians get the effigy.
Uh-huh. Uh-huh. Uh-huh.
It's not necessarily that their food is spicy. It's because you're using a lot of tomatoes and a lot of things that have a lot of acid in it and stuff. So, but going now, let's go back to some remedies we talked about, all that other stuff that you could get to put, in your water, ginger, on your tea, I should say. But some over-the-counter stuff. And I would suggest, if you have this issue, that you need to get a gastro doctor and he will guide you to what they need to do. Most likely the first thing they're going to have you do is a colonoscopy. It's not that bad, people. It really is. And it
Right.
could save people's lives. And then they'll tell you stuff that like I take a medication in the morning. Don't ask me the name because I don't know the name offhand. But it's it's like to coat my stomach before I
Mm-hmm.
do anything.
Mm-hmm.
And because I take so much medication anyway, I have to make sure that my body is like coated and it's going to be okay. But they'll probably give you something like that. And then they'll tell you some certain medications that you get over the counter. But most of the people are up late at night when they're in a lot of pain and they're looking in their medicine cabinets for medications to use. Make sure if you have these issues, when you go to the store, get a couple things so that they're ready for you when you come back or something happens. So you're not like, fishing around 11, 12 o'clock at night trying to find medication to help you out. Any thoughts on that, Deb?
I got two things I just want to say. One, also going back to the doctor situation, they're recommending colonoscopies at 45 now, but sometimes they may have to go down and scope into your tummy too. And sometimes they'll do that at the same time, which is kind of like a 2-for-1 thing, but it's okay, good, because they check everything out. But I also want to make mention that guys, avoid eating late at night, because when you go to lay down, okay, especially desserts and stuff, that can come back up on you because that acid, and then you're gonna have a horrible sleep and you're gonna be a mess. And the next day it's gonna be layers of things that you got to work on because it's gonna be a problem. So it's never suggested to eat late at night. It really isn't.
Yeah, they're saying that you should wait 3 or 4 hours to go to bed after you eat. To digest, and like you said, you're laying on your bed and all that acid is coming up, and that's to be another thing that you should look at when you're trying to figure out this whole situation with the reflux and what you should do for it. Is to kind of write down what time you eat, how long it takes you to eat, and so
Good idea.
a pattern of what's going on. Because I think once you see the pattern of what's going on, you could kind of see why you're having issues. Again, Debbie's big saying is be an advocate for yourself, because it is really important that you do. I don't have any other thoughts on anything else. I'm trying to think of any other, things that I learned along the way to help me. But I know what the best thing to do is be your own advocate and go out and look and try different things. But you really won't know what aggravates you until you eliminate it. And you got to figure out a way to do that.
I'm bringing it one more thing too. If you do have to seek a doctor, I think that we all have to remember one thing. Don't go in there and just not be prepared. Like Lori was just saying, write down everything and be super prepared, because doctors these days don't have the time to spend with the patients like they used to. And you don't want to go in there and then you walk out the door and you forgot to ask da 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 da. Now with my chart and stuff like that, lots of times you can contact the doctor, but they're not going to necessarily be able to get back with you as fast. But I think part of being your own advocate is you've got to be really organized, because that's to find out,
Yeah, so. You have to be really organized again, and your times and everything too.
Right, definitely.
Remember to be aware of your surroundings when you're eating, that you're not involved in something so intense that you don't pay attention to how much you eat and how fast you eat. And we're only saying this, not that we're, Debbie and I never claimed to be a know-it-all on all this stuff. We do research on it just like you can, or we talk about experiences that we have had in our life with it. And so when Debbie brought the topic to me, like I said, I was so excited because it's something I'm still learning about that I got to help myself to get better with. Right. And every day should be a new day to figure out a better way to be the best person of yourself,
I just want to add, it's never too late to attack something. Don't take it for granted that you're gonna have to be complacent and be, oh, I can't get this, I can't make it better. They're always coming out with new ideas, new things, new
Right,
techniques, new
right.
studies, everything of how to make yourself, attack that like situation. So, anyways, but with that, Laura, do you want to close us out?
I sure will. Everybody, thank you. And it's such a pleasure to come in your house and our work or whatever on Wednesdays and Fridays. So with that, I'm gonna say have a great day. Happy March 1st. Take care. Bye-bye.
Bye, y'all. Take care. Bye bye.